If cervical cancer is preventable, why is it still a public health problem in 2026? Because women are still being diagnosed and women are still dying from something we can largely prevent. I'm Dr. Hade. My master's research on cervical cancer was done back in Nigeria. And what shocked me back then is this: even highly educated women were missing screening. And here in the UK, despite HPV vaccination and screening programs available, cervical cancer still remains a public health concern. And this part is critical. Screening is not for people with symptoms, it's for well people before symptoms start to develop. I'll be using the UK as a case study in this video because the data is clear and publicly available. But the message in this video is global. Wherever you may live, cervical cancer follows the same biology. What changes are the systems around women where you are located. When we say something is a public health concern, we don't mean it's rare or inevitable. We do mean it affects many people, it causes avoidable harm, and outcomes depend on systems, not just your individual choices. That's why cervical cancer is still being discussed at population level in the UK and globally. If you watched my video on vaccine hesitancy, then you already know this. HPV vaccination is powerful, but vaccination alone isn't the full story. Whilst vaccination protects the future, screening protects the present. And when either layer drops, disease doesn't disappear. It concentrates in the gaps. Cervical screening is not a test for cancer, it is a prevention test. What screening looks for is high-risk HPV. That is the virus responsible for the vast majority of cervical cancers. If HPV is found, the sample is then checked for early cell changes long before cancer develops. This is why screening saves lives. By identifying risk early, treatment can happen before cancer ever forms. Countries with organized screening programs have seen significant reduction in cervical cancer incidence and death over time. This is also why screening is considered one of the most effective cancer prevention tools in women's health. I also want to say this clearly. Cervical screening is an intimate and sensitive test. For many women, it brings anxiety, embarrassment, or memories of previous discomfort. And those feelings are valid. From July 2025, cervical screening changed in England. Now, if you're aged between 25 years and 49 years, and your screening test is HPV negative, routine screening invitations moved from every 3 years to every 5 years. This doesn't mean screening is less important. It reflects how HPV testing helps identify risk more accurately. And this principle applies in many countries that use HPV-based screening tests. But this only applies if you have no symptoms. No matter where you live, Africa, Europe, Asia, the Americas, these symptoms matter. Do not wait for a screening appointment if you notice any of the following symptoms. 1. Bleeding after sex. 2. Bleeding between your periods. 3. Bleeding after menopause. 4. Persistent unusual vaginal discharge. And 5. Ongoing pelvic pain or pain during sex. These symptoms do not automatically mean you have cancer, but they do need medical assessment. This is the safety net rule, and it applies everywhere. If you have symptoms, don't wait for a screening program. Seek medical assessment through whatever healthcare system that you have access to: a GP, a clinic, hospital, or a community health provider. Screening is for prevention, and symptoms are for assessment. Symptoms always override screening schedules. So, what actually happens at screening? If fear or uncertainty has ever stopped you from attending screening, let me walk you through what typically happens so that there are no surprises. When you arrive, You will usually be seen by a trained clinician, often a nurse. They will explain the procedure and ask for your consent. You can ask questions and you can change your mind at any point. You will then be asked to lie back and position your legs comfortably. You can ask for time, privacy, or help adjusting. A small instrument called a speculum is gently inserted so the cervix can be seen. A soft brush is then used to take a sample. This takes seconds. Most women describe discomfort or pressure, not pain, but experiences vary. The speculum is removed immediately. You can then get dressed straight away and return to your day. Some women may notice light spotting. This is common and usually settles quickly. If you've had pain before, you can ask for a smaller speculum, extra time, a different position, or for the clinician to stop at any point. And if you've avoided screening because of a bad past experience, you are not alone. But please know that a different approach, a different clinician, or even new method like self-sampling in some settings can all make a big difference. One of the biggest misconceptions is that low screening uptake is just about ignorance. It's not. It's about real life barriers. This includes experience, which may be from a previous experience or emotional anticipation of pain or embarrassment. Access, fear of screening outcome, cultural and religious beliefs, and messaging gaps. This pattern is similar to what I saw during my own research, and it's what data continues to show in many countries, including the UK. Cervical cancer doesn't affect all women equally. Where screening and vaccination don't reach women well, disease tends to concentrate. One of the most promising developments globally is self-sampling. For many women, removing the speculum removes the biggest barrier. Many countries, including the UK, now talk about eliminating cervical cancer as a public health problem, not overnight, but sustainably. The tools exist. The challenge here is the reach. Wherever you live, these principles apply. 1. If you're invited for screening, book as soon as the invite arrives. And if you live in a country where screening invitations are not routinely sent out, now you know you don't have to wait. You can actively book cervical screening through a clinic, hospital, community health center, or screening facility where it's available. Prevention doesn't always come to you. Sometimes you have to go to it. 2. If screening has been painful, you can always ask for adjustment. And thirdly, if you have symptoms, seek assessment. Do not wait for screening. And if you are a parent, HPV vaccination today prevents cancer tomorrow. Please remember that. Cervical cancer persists not because women don't care, but because prevention doesn't always meet women where they are. So wherever you're watching from, this message is for you. I've linked the free cervical screening checklist in the description. If it's something you'd find helpful, feel free to comment checklist so others can spot it easily too. If this information helps you, keep it and share it with one woman. Prevention works best when it reaches the right person at the right time.